Welcome to our National Nursing Home COVID Safety Echo. Thank you all for joining us. This is our 7th session, so you all know very well by now. The goal of this echo is to reduce COVID-19 related mortality in nursing homes. And there will be in the chat the more details for it. We're gonna hop right into it with introductions. Let's start with our IT staff. Calvin, would you mind introducing yourself?
Good afternoon, everyone. My name is Calvin Martinez, and I'm with Project Echo IT. I would like to remind all of our participants to please mute themselves while they're not speaking, and you could do so on the lower left-hand corner of the screen. If you are dialed in via phone, you could dial *6 to unmute and mute yourself. Thank you, everyone.
Thank you, Calvin. And we'll go around and have our hub team introduce themselves. Meanwhile, if our participants wouldn't mind introducing yourselves in the chat with your name, your facility, and your role. Let's start with Cynthia.
Good afternoon, everyone. My name is Cynthia Olivas. I'm a nurse manager with Project Echo, as well as the Department of Neurology at UNM.
Thank you. Marissa?
Hi, everyone. Marissa Marquez, Program Coordinator at Echo Institute.
Thank you, Marissa. Christina?
Hi, everyone. I'm Christina Southey. I'm an Improvement Advisor with the Institute for Healthcare Improvement.
Thank you, Christina. My name is Crystal Apodaca. I'm one of the co-medical directors for this ECHO. I want to share with you quickly some great news. Starting today through week 16, we will be able to offer CME and CNE. There's going to be one survey at the final session in order to claim all of those weeks worth of continuing education. I'm going to pass it over to Joellen from IHI to introduce to us Higher Logic.
Thanks, Crystal. Hi, everyone. So I am excited to share this new IHI community platform with you. I know Marissa is going to help us to chat in the instructions for accessing it. I'm going to share my screen quickly. Maybe. There we go. Hopefully you can see that. And so this is our community that we have built for this kind of ECHO project. This community has folks from across the country that are quickly joining on. You folks are a little bit ahead of the game being our pilot group, but we have others who have just started the first couple weeks of their curriculum this week and last week. And so this is a place that we have built for everyone to kind of come together. This is the homepage that you'll see once you sign up and log in. Some of the neat features here. So we have a discussion board, which has been getting more and more active as we have folks joining. There's some general kind of questions about access, but we're also having folks start asking questions of each other, like, how can we do this better? Or do you have any ideas for solving this issue that I'm having? And so we're really excited to see that happening and hope that you'll join us there. We also have the library that's available to you all, and this will include all of the videos and the other materials that we've shared with you, including PowerPoint slides, some external resources, YouTube links to every expert video, everything that's really been shared over the past 6 weeks. I think we're on week 7, and will continue to be shared throughout the rest of the 16 weeks that we have together. So that's something you always have access to here. We also have a sub-community feature, so you can join, and we're still working on building it out, but you can actually join the New Mexico Training Center sub-community. And so this will be an opportunity for you all to have your own kind of private community with folks that are in New Mexico. You can share and access library materials that are really specific to your state or to your region or even to your nursing home, nursing facility. And you also have a discussion board, so you can connect if you'd rather just with folks that are in your smaller cohort and have conversations. You might have a case that you didn't get to present at one of these meetings that you would love to get the input of your community on. And so that's a very quick overview. I know Marissa has the instructions to join, and of course, we're always happy to connect and help you get access.
Thank you, Joellen.
Yeah.
And yes, if you have any questions in regards to higher logic, it's such a great tool to use in conjunction with this echo. Next, we're going to move on to our beginning poll. What did you do to improve your facilities COVID-related practices in the last week, if anything? And then you can check all that apply. And while we go through and finish up that poll, I'm gonna ask if your name on the screen doesn't match who you are, if you would rename yourself so we can know who we're talking to. If you click on your box, there's 3 little dots and you click on those and you can rename yourself. And also if your camera is functional, I will ask you to turn it on to help us create this sense of community. All right, it looks like 50% of people worked on a change opportunity with a team. Fantastic. Wonderful. Great job, guys. Okay, I'm going to pass it over to Cynthia Olivas for our case presentation.
Good afternoon, everyone. So we're going to move on to our case presentation. And today we have a case presentation from Cynthia Irwin. Cynthia, are you ready to present your case?
Well, actually, my director put it in, and I'm not really sure what she put. Excuse me, what she. So if you give me just a second to read it, we are having a snowstorm, and she was unable to make it today. So I will do the best I can.
Okay. We're going to have 5 minutes to present the case, and you can do the best that you can.
Okay, according to her, well, and it is hard to attract workers to long-term care, and finding it more difficult for COVID simply because people are scared. All the news and everything is COVID, you know, in the nursing homes and how many people have died in the nursing homes and all this. So I guess our question is, how are we attracting employees? Does anyone, we are a small community, like I think we're about 3,000 people. We are 45 miles from the nearest town of 10,000 and 80 miles from anything that's even bigger than that. So our worker pool is very small. And we have competition money-wise from the prison here in town. They pay very well. So we're asking, do you have any ideas on how to attract employees?
Okay, well, thank you, Cynthia, for bringing this case forward. So we're going to give the opportunity for the network to provide any clarifying questions for you. Is there any questions that anybody has for Cynthia regarding their question about attracting more staff to the long-term care facility, especially in light of COVID? Any of the hub team members have any questions for Cynthia that they would like to ask? Oh, Linda, do you mind unmuting yourself and asking your question?
Hi, our question was, where are you located and how far are you from a big city?
Okay, we are located in the northeast corner of New Mexico. We're 10 miles from the Texas line and 10 miles from the Oklahoma line. I don't know what you consider a city. I guess the city of 30 to 50,000 is at least 2 hours to 3 hours away, which would be Amarillo, Texas. We have smaller towns, about 10,000, that are 45 minutes away.
Thank you.
Mm-hmm.
Thank you for your question. And Laura Finch, do you mind unmuting yourself and asking your comment? presenting your comment to the network?
I'm just an observer, but I'm just wondering, we're in a different place than we were in March when everybody was quitting the nursing homes. And I'm wondering if people will start feeling more comfortable and with having this venue and these practices shared, if that will help people feel more comfortable being at work.
I would hope it would, but I just saw a lead story in the news today about how many people have died in nursing homes. I'm afraid we just got kicked again for it. Again, a small town, we have a very small labor pool. They've all pretty much gone through here, gone to the prison, come back here, and our hospital's even small, so we really don't have much competition other than the prison. We do have workers that drive 45 minutes away and 10 minutes away. But right now, like I said, snowstorm, we have nobody here in town. So COVID is scaring people here. But then again, I don't know. I don't know what we're going to do.
Cynthia, this is Crystal. I'm wondering what things have you tried in the past prior to COVID that have been successful for recruitment?
Well, see, there's where I'm kind of stuck because I'm not real sure what they have done. I know they advertise in the paper. They advertise on Genesis. We have had, I do believe we've had a couple of travelers that did end up signing on with us. So, but I'm not sure what they offer, as far as bonuses or moving expenses or anything like that. I have no idea.
Cynthia, this is Cynthia from ECHO. Quick question. Just wondering if your HR department or marketing department, however you're marketing your jobs, has added any language about COVID-19 and what you're doing in the nursing home to protect not only the residents, but the staff?
Well, there again, that would be a Carolyn question. I apologize. We have one HR person and one that does our marketing. And both of those ladies have been here for over 20 years. So just their own presence is a good sign. And I don't know what they've done. I don't know what's out there or what they've changed. I apologize for that one.
No, that's okay. Does anyone have any other clarifying questions before we move on to recommendations? Okay, thank you. Linda, do you mind unmuting yourself and sharing your comment that you have regarding certified nurse aides?
Sure. Here at our facility, we're rural, and what we've done is we've offered a certified nurse aide course on site, and we have a nurse educator that offers this course. And so what we're doing is we grow our own, and that seems to really help us. And it also creates a career ladder for nursing. And so I don't know if you have that possibility, or if you have someone you could contract with to offer that type of course.
Oh, yes, actually we do have, I'm sorry. We do have a nurse educator here. We do offer the CNA course. I've seen, because she's in the same office I have, we get them like 1 or 2 at a time if we're lucky. And she actually educates for Raton, which is 80 miles away from us. I've seen more from there coming in here than I've actually seen from here. But yeah, she's good. She's really good. She works well with them, and I can't think of one that she's recruited in last year that I've been here that has quit. So we do good. We just don't have very many people coming in. Thank you.
Thank you. It looks like Susan, do you mind sharing your comment, unmuting and sharing your comment with the network?
Sure. In the past, Lakeview has offered their own class, but we're partnered with our local college that's associated with New Mexico State University. And they offer 2 to 3 classes per long semester. And I have a calendar of when those classes occur. I know what aides need to go in. I know I have about 90 days to get them in and get them through when we're not in the pandemic. And it works out fairly well here. Lakeview does pay for that class for them. And oftentimes I've found that it's a real springboard for them to go on and take additional classes.
Well, thank you. Thank you for sharing. And Lisa, do you mind providing a comment regarding reaching out to colleges? Okay, thank you. I'm sorry. I think one comment that I will make, I'm going to go ahead and take the floor here for a minute. I've known in the past when I've worked in a long-term care facility that we actually have gone to career day and tried to recruit CNAs and nurses for our facilities. So that is something that maybe, you know, you could do via Zoom now, right? To provide information about your facility. So that's my comment. It looks like Nikisha says that Skies has a need for RNs, LPNs, and CNAs. And I'm sorry, Linda, do you mind unmuting and commenting about your I think it says wildlife sightings?
Yeah, here in Los Alamos, we believe in pet therapy, and you're guaranteed wildlife sightings if you come up here and work.
Okay. Thank you.
Yeah.
We have our own 2-legged and 4-legged wildlife around here. We have a couple of rabbits that live out back that the residents watch. So, yeah.
Okay. So I'm going to go ahead. If nobody has any other recommendations to add or has any comments that they would like to make, Sharon has a question. Sharon, do you mind unmuting and sharing your question?
Sure. My question was if anybody has found any particular effective messaging strategies. As the presenter mentioned, there's a lot, you know, in the news about nursing homes and COVID, and probably a lot of misconceptions out there that might make it more challenging for workers to feel safe. You know, at least the perception is out there. So just wondering if anybody's found an effective strategy or has tried working with media or working within their corporation to kind of put out some messaging about, somebody had mentioned what you're doing, what you found effective, keeping people safe, you know, the realities of having somebody with COVID in a long-term care facility might be kind of misconstrued a little bit by the general public.
Thank you, Shannon. Does anybody?
Well, it's actually been misconstrued even by my own staff. I will tell you, when we opened up a large COVID unit, and I had, I don't know, I think we've had maybe 12 or 13 or 14 employees in various positions become COVID positive. When they returned to work, I lost off of that unit probably 4 daytime aides because they were afraid. So it's not just the general population, and we educate all the time, but how do you continually educate even in your own facility? Because once someone's scared, it's hard to talk them out of that. It's safe for a lot of different industries than healthcare.
Thank you, Susan, for sharing that. Does anyone have has used any messaging strategies as mentioned by Shannon?
I know locally here, they have had, I haven't been involved in them, but they have PSAs run on the radio specifically about working in the homes in the area and how important it is. And it's very much like a promotional positive framing. And it highlights the need for people to be able to support this really important sector. So there has been collaboration between the local government and the sector to to get those messages playing on the radios, so that if anyone is thinking about it, that they might be able to reach out. So I don't know if you've had any collaboration from your town council or any of your local government in helping you with this, especially during COVID, because I wonder if they might have some avenues that you might be able to support you.
Well, again, here, I don't know. Carolyn would be the one that would be handling that. But yeah, that's a wonderful idea. We do have a small local radio station. I will present this to her and see if we're not doing it, if we can. So that's a good idea.
Another thing, one of the things that Lakeview has done, and the CEO, who's also our acting administrator currently, she's very well connected locally, but on through the state level. And we have a mayor who's been very closely connected with Lakeview for a long time. And the local newspaper oftentimes covers positive things as well. And one of our chaplains, actually, we ask for people to simply come and pray. And we've had all kinds of people out there, outside. So there are very effective ways to do education, because we've also educated for COVID at the same time.
Well, thank you, Susan. Thank you, everyone, for sharing. Donovan and Linda, I see your comments in the chat, and we appreciate you participating. In the interest of time, I'm going to go ahead and turn this over to Crystal to review any recommendations that you all provided.
Thank you for presenting this great case, Cynthia, on the fly. You did a great job. And some great recommendations. So advertise with information regarding what the facility is doing for COVID safety for staff and residents, perhaps utilizing the local radio station to educate the public on COVID safety practices at the facility. Offer a CNA course on site to grow your own, if possible, or pay for CNA class for staff at surrounding colleges. Reaching out to colleges in the surrounding area to recruit from nursing programs, attend career days to recruit, and play to the strengths of your area, i.e. wildlife sightings. And we'll be sending these recommendations to, well, I guess to Carolyn, but yeah.
Thank you, Cynthia, for taking the time to present. I hope you found the recommendations helpful. I just want to remind everyone that we would really love to hear any problem, concern, anything that you want help in trying to navigate. If you could please present a case. Marissa has placed that case form in the chat, but you can also find it in your weekly announcement.
Thank you, Cynthia.
Thank you.
And Cynthia Irwin. All right, next we have another poll. Here it comes. Please indicate which of the topics from the previous 6 weeks have been useful in providing new ideas to test regarding your facility's COVID-19 response. Laura, thank you for your comment in the chat. Okay, great. It looks like cleaning and disinfecting, and then tied in second place is PPE, managing COVID-19 in nursing homes, and advanced care planning. Wonderful. Thank you all for taking time to to answer that. All right, so next is our didactic portion. For our didactic today, there is a pre-recorded presentation from David Farrell on leadership and communication. We'll put his impressive bio in the chat, as well as a link to the video and the full set of slides. The video is 23 minutes long, so for the sake of time, I'm going to give a very abbreviated version of his presentation and hopefully do it justice. So I'm going to share screen here now. All right, so David Farrell's been in the nursing facility game for a very long time. And one of the big things he talks about is how you want to be remembered after all of this mess, right, that we're going through together. Be the leader that your staff needs you to be, validate, support, encourage, act calm even if you don't feel calm, share everything you know, total transparency, and cite sources and data, so let them know where you're getting your stuff from, and be predictable. So this is a good time to be predictable so they know what they can expect from you. What matters most during COVID-19? Leaders, you all matter most. You need to show your people that you care, that you listen, and that you help with their job stress. And that means more than all the other things. Person-centered care leadership, so balancing performance with compassion, right? We all have goals that have to be met, but also that we're compassionate in meeting them. Okay, make sure I'm not missing a chat here. And next. So these were, and again, this will be available to you. So these were all of the sources that he shared with everyone to stay on top of all of the changes that occur daily. And now that we're hitting our subsequent surge, daily is how often things are changing again. Dr. Nimalie Stone, you'll recognize her. She's the lead epidemiologist in nursing facilities for the CDC. But talking about being proactive, so being the first to implement restrictions and interventions, those are the ones who have kept it out or minimized the outbreak. And so being proactive is the way to go. There we go. So what more can leaders do? These were some suggestions that he discussed, and these are likely things you are already doing. Weekly webinars for families, and that's educating on COVID in general and your facility's COVID practices, proactively calling families, dedicating staff for COVID wing, feeding the staff safely, suggested groceries for staff, hotel rooms for those who need to quarantine away from high-risk family members, and if possible, generous sick and quarantine pay policies, clean scrubs each shift, and choosing one job, so not spreading people so thin, if possible. And this was an interesting, why this is so important that staff is well taken care of, because they can unknowingly infect residents, right? So a lot of people, we know this, a lot of nursing facilities share staff. And so they work in multiple facilities. They work while they're symptomatic because they don't have the paid leave to take sick days off. And this is something that happened in all three of these cases, that the staff unknowingly infected the residents, not out of malice, but out of not having certain needs, their needs met. So this is a bundle of leadership best practices, and this is a big thing that he goes on, gives great detail in the video. So doing rounds with your staff, and those are important with words, behaviors, timing, right? You don't want to try to have rounds during med pass, bad timing. Notes, that you are acknowledging people for what they've done with thank you notes, that kind of thing. So those having the right content, timing, and again, predictability. And then huddles. And so these huddles are more listening, letting people tell their stories, and sharing the data and strategic plan. So purposeful leadership rounds during COVID-19. And so high visibility, that you're out there on the floor with your people. You are in the spotlight. So what you do and what you say is seen. And that you are making keen observations, that you're verbal, linger, assist, make eye contact. These are basic things, but they really go a long way during this very stressful time. And this was a nice little example of what to say and do during rounds. I'm worried about, I'm proud about, thanks for helping, that was nice of you. The residents really love you. And while you're out there, you can answer call lights, hold doors open, sit down, move a linen barrel, all those things that we love to see our leaders do, and we as leaders probably naturally do. So whenever you're making the rounds, to make them meaningful, 5 key questions. You want to build a relationship, and this should be sincere. I think that maybe goes without saying, but it should be sincere, asking them about their family outside of work, being positive or focusing on the positive, and then that positive feedback loop, so that they, you let them know what they're doing great and ask them if there's anyone they want to recognize. Infection control, is there anything we can do better? And then needs, do you have everything you need to do your job? And so that was rounds. This goes on to the notes portion of that leadership bundle. And so elements of a good note, you can read these here. So positive stuff, staffing changes, that they're sincere. And cards are, believe it or not, a very powerful motivator. Birthday cards, anniversary cards, attendance, anything that stands out. Writing a card, it's minimal input for the leader, but a huge output for how meaningful it is. And if you're able to mail it to their home, that goes a long way as well. Now here we go on to the huddles. So we did the rounds, cards, huddles. So consistent and reliable, that you share data, stop rumors. That's an important part of huddles. Tell a story, so make these percentages mean something, right? And being transparent is huge. And you can be cautiously optimistic, as long as it is sincere. Teachable moments, predictability, also huge. And then you want to ensure everyone has the same information, and that you promote collaboration, and that it's a safe place to talk to people and for people to be heard and share their concerns. That is his contact information. Again, you'll get a copy of these slides. The video is great. He goes into way better detail than I have done here. And if you want to view that. Okay, that was it. That was the whirlwind of David's presentation. What questions are out there?
Mine's not so much a question as a praise for the people I work with. The ladies that have been here that are in the offices now are all licensed CNAs. They get out, they answer lights, they lock their doors, they go help on the floor. They've always had a birthday card and everybody gets a cake. And this has been going on way before this started. So, and then, they get, like when someone comes to work here, all the managers sign a card saying thank you and stuff. So they've done a lot here to try and keep people here.
That's wonderful to hear, Cynthia. Thank you for sharing that.
Mm-hmm.
Anyone else?
I think I find it interesting that during a crisis, whatever it may be, the true character of someone always shines through. And hold hopefully those same people who have that integrity during crisis have that same integrity and show those same things during the mundane, because a lot of our days when we're not in pandemic are very, very much the same. And I will say that we did struggle a bit once we closed our COVID unit to everything. Leadership, there were several things that came into being, but we did not enter that unit. The CEO and other director of nursing were wonderful about having huddles. We stayed in contact with staff, but that was a big struggle when we were at the height of COVID here. It was a struggle, giving staff what they needed and they deserved. And making sure that there was good leadership going on inside the COVID unit, because hopefully we all are fortunate to have people who have experience. Many of the units that were being managed as red units may not have had very strong leadership internally. And I know that if you all think about it, maybe you're fortunate that you didn't have a large COVID population, but at any one time we had 25, 24 residents that were positive. And by the time you close off your staff and all those other things that you have to do, it just becomes very difficult to lead through that.
Thank you for sharing that, Susan. I imagine you're not alone. And
oh, God. We have learned from those who went before, I can assure you.
Yeah. Linda, would you mind unmuting yourself and asking your question, maybe expanding upon?
There. We're just wondering as a group if anybody kind of has the same feeling as what we've seen in the community, that the staff and the leadership feel like, how do we get the State Department to actually not only to come in and make sure that we're in compliance, but also to show a level of compassion and support for the staff. Because part of that being scared and stuff like that is the staff feeling pressured and wanting to perform well, and we're not, and I'm sure other people are saying that as well, don't feel like we're getting support from the State Department. And I guess we're wondering, how do we get the message out there, or how do we make them understand that they have to be part of the solution as well for staff and things like that?
Well, I think there are a lot of people trying to be the solution, but the messages are not congruent. You may receive some message from DOH, some message from somebody else. So the messages that people are receiving are not even the same messages.
I wonder if that's part of the comment from David's presentation. And if you have 23 minutes in your day in the next week, I would encourage you to listen to it. It is a good presentation. One of the things he talks about is stopping the rumors and sort of being that consistent communication. And I think about the fact that you do have an onslaught of communication and sometimes inconsistent communication coming from different spaces, and the role that then leadership has to play in helping people to understand, like, what's important for us now, what does this mean for our work, what does this mean in terms of what's out there to support outside of work. And I wonder if there's any folks on the phone who have had any successes in that, in terms of how you've taken the the amount of information that is coming at people, and sometimes the conflicting messages that are coming at people, and helping to have a consistent sort of message and consistent communication for your staff, because I imagine that can be something that you're all challenged with on a day-to-day basis.
I'm going to say here, when the pandemic hit, we had one person that we were to go to for information or for questions. Now, we had numerous people on calls and those things, but the CEO was the one, if you had a question, you go to the CEO. We all knew that, so we could keep a consistent message. Yes. Too many people giving answers just facilitates that frenzy that environments feel. But and it didn't matter who you were. You could be the maintenance worker. You could have been the, I don't know, the other director of nursing. You could have been a charge nurse. You could have been an aide. But if there was a question, that CEO would field that question.
And how did the CEO make themselves available for that? Because I imagine that's someone who has a lot of different demands in their time. So how did they make themselves available and present for all the different people who might have wanted to ask them questions or get information throughout that early phase of the pandemic?
The staff here, now, we're not a huge facility. We're 112 beds. We have about, I don't know, 150 active employees here. They have her cell phone number. And she also went out with the other director of nursing or myself. I'm the director of staff. She would go out and have huddles with them. She would go outside. She is very articulate, and she's been here a long time through almost every level in the organization. So her heart bleeds this facility, and it showed to the staff. It did. She made herself accessible.
That's great.
So
Our
Susan,
director
this
of
says,
nursing is the same. I'm sorry. Our director of nursing is the same. She's our spokesperson. We're a smaller facility, but everyone has her cell phone number. And when this first started, she held meetings every day to give out the information that came. She sifted it all, put it all together, and gave it out to us. But if anyone has a question, and still if anyone has a question, she's the one they go to. And she's very good about answering.
so this is Cynthia from Echo. I just have a quick question. That's great that you have leaders that are receptive to the questions. I'm just wondering how these questions are shared with other staff members, because they may have the same questions, right? So is this something that's shared in your daily huddles with questions that came up the previous day, or how is that shared?
Yes, it can be shared at your morning IDT meeting or your 4 o'clock in the afternoon, or a list will come out with the last 300 asked questions. Yes. And then I will take that and go educate staff, handouts, those things. And it's just kind of a trickle down. But in those daily meetings, we also understand that it takes everyone's input. Oftentimes, if we were developing how the food needed to come out from dietary and be taken into the COVID unit, I might not be the best person to answer that, but our director of dietary would come in. So it is a very collaborative administrative team here. Feel very fortunate.
Susan, yeah. I'm going to, for the sake of time, pass it along to Christina, who probably is going to help expand upon all of this.
Well, and thanks for that, Crystal, because I was just thinking as we were having this conversation that really the conversation that I wanted to support with all of you today is sort of a continuation of the conversation that we've already been having. And I think one of the things that I'm thinking as I'm listening to all of you is that now that we're sort of getting back into a second wave potentially, at least where I am, and well, hopefully not where you are, but I'm wondering how some of the lessons from the early on in the pandemic, in terms of things that went well and things that didn't go well, are maybe helping you to inform how you approach your strategy around leadership and staff support now. Are there any things that you're changing, or any specific aspects that you're making sure that you're ramping back up again, or continuing based on your experience in the first 6 months of this pandemic? And if there's any folks on the phone as well who are in, in various people, there's lots of people in various positions on the phone. I'd also love to hear, if from your perspective as someone who is looking to a leader for guidance as well, what maybe has worked particularly well or has been more challenging as you've been working through in your facility over the last couple of months. We'd love to hear sort of not only those in a leadership position who may be responsible for some of these activities, but also from those who are working with leaders that are moving through these various phases we're in.
Hi, Cynthia from Clayton again. Again, we're a very small facility, and it seems to be working well. They've continued with what they were doing before. Fortunately, our director of nursing has actually managed to get some sleep in the last couple of months, where she wasn't before. She literally was almost living here when the crisis first started. So, but from what I can see from my point, I'm kind of like middle management, if you will. It seems to be working well, and I see cheerful aides come to work. I don't see any problems cropping up.
Great, thank you.
I'll go ahead and talk a little bit. So we're a CCRC where we've got, and so the healthcare unit's only 50 bed, we're small. And we were hit with COVID in April. And when you were talking about needing to have somebody in charge, we experienced that from the government level. Because we were one of the first places hit. And so we had top people from the Department of Health coming in telling us what to do, but we also had the Bernalillo County emergency response telling us what to do. And finally, one of the people said, I am in charge, you go through me. And so that helped, having one expert telling us what to do, because we had two different experts, one from Bernalillo County Response Fire Department, one from the governor's office, and they're conflicting information, because back in April, this was all so new. And so finally, Bernalillo County said, you go to me, we are going to tell you what to do. And they became the person. So that was really helpful. When we were hit, I got COVID, so I was out. So our executive director and the infection preventionist and the dietary manager were the only people that were here. And so everything was filtered through the executive director, and then I was available. So we've kind of kept it at that level. A lot of the clinical things will go through me or the infection preventionist, but ultimately it's the executive director that makes the final decision. And I agree. Unfortunately, through this thing, everybody has our cell phone numbers. Everybody's able to get us at home, family members, everybody. But that was the only way we could communicate during the COVID. So, but we're still managing through one person for the most part, making the final decision, and that we've maintained that, and it's worked the best way.
Thanks, Carolyn. Thank you for sharing that. And we've heard that theme come through in a few folks, that consistent communication, that there's sort of a point person who's able to filter what's coming in from outside, and then what's flowing through the facility can be very helpful.
Christina, this is Cynthia. Richard, I think, had a question. Richard, do you want to go ahead and unmute yourself?
Well, it wasn't so much a question as at our center, at the Rehab Center of Albuquerque, a lot of staff were very anxious early on. And now whenever we have a staff person or someone test positive, there's not the angst. I was going to say, in fact, not meaning to sound flippant, but we have more call-offs because of the snow the last 2 days than we have for COVID. So I think we have daily meetings with the staff. We send out constant communications with the family, the residents. So really, I think keeping everybody informed and really pushing the numbers that are being reported by the state of New Mexico and encouraging everyone to maintain their precautions, that's helping the center, for us anyway, to keep COVID out.
Fantastic, thank you for that. And I wonder if others are maybe seeing the same, that as we move into almost like a little bit of a rhythm, that there's a bit more predictability, and that we're able to assuage some of the fears and concerns of staff with employing some of those strategies like communication, as Richard was talking about. I also think there's a really important comment from Linda in the chat around the impact that a lot of this is having, and the consistent stress is having on those in leadership positions, and our own health and well-being. And I'm wondering, we talked a couple of weeks ago about what we're able to do for people, for staff as well as leaders, around supporting the health and well-being of staff in and outside of work. And I know that comes through in David's presentation as well. How are we taking care of people? I'm wondering if there's folks on the phone who maybe have tried some strategies to reduce the impact of the stress, address the stress, or even just support the wellness, so that we don't have people having to call off because of illness and other stress-related issues as the months progress.
I don't think we've been as sensitive as I would like us to be here. You made the comment about one job a little while ago. Somebody said that about not overloading people, but letting them have one job. There isn't one leader here who's had one job, I can assure you. Most staff have had one job that really fell more into their training. But facilities who are chronically understaffed, because I don't come from long-term care. I have 44 years of experience as a nurse, but most of it was in acute care and an acute rehab. The chronicity of the staffing issues in long-term care makes it very difficult to give people what they deserve. Not just what they need, but really what they deserve. We've all had times of people needing off, and because we haven't had the staff to replace them, we haven't given them off, or I don't think that we've done as good a job as we need to do. And I'm not sure we know yet the long-term effects of the pandemic on the staff. But I'm going to quickly tell you a story that brought it home to me. And if I tear up, I apologize, because it's very raw to me. We moved from a small red unit to a large one, all in the course of about 4 hours, because we realized that 8 beds was no longer enough. And I went to that unit, and I couldn't go in. I could open the door, but I couldn't actively go in the unit. And the evening shift charge nurse came, and she stood 6 feet away from me. And I stood in a doorway, and she began to weep because they were dying. She said, "Ma'am, they're all dying." It was the first time in my career I felt totally helpless. I couldn't reach out and hug her. I couldn't reach out. I couldn't I couldn't do those things. I'm a real people person. I couldn't do them. And it took me 2 days to recover from that. So I'm not sure. Now, she has since had time off. That unit is now open. We were able to close down our large COVID unit. We are COVID free, but it took her about 2 weeks to recover. And it was the first time I recognized PTSD because I believe that's where she was. So I know that we are not here at Lakeview doing what we should for our employees. No.
Thank you for sharing that, Susan. I think that really does bring it home in terms of what you're all seeing and having to support people through in your facilities every day.
Yes. Everyone that's on these calls has been there. Everyone. And if you haven't, you will be.
Is there any way that there folks have on the line today have found a way to be able to honor that, to be able to support staff through that? Any sort of rituals or way to be able to help people to deal with the experiences that they're having that are so overwhelming in this time?
Well, this isn't really so much for a kind of, so it kind of is. So we've had so many deaths since the beginning of this, and not just from COVID, but just from people in hospice and different things. And because we can't open up anything, and we just finally had to draw a line in the sand. That's a bad way of saying it, but we had to put some closure to the deaths and honor the deaths that we've already had. And so we were able to, last week before, when the weather was beautiful, we had a memorial service. We did it outside. We had staff read names of residents that have passed away. And we had over 40. And that's not just my area. Again, we're CCRC, it's assisted living, it was independent living, and some were not COVID, but they were deaths. And it was a beautiful service. We had a chaplain give some words and some scripture. We had each staff read the names and put white roses into a vase, and had bagpipers and everything, and honored them. And this, we included the staff that have been through, that were in my unit, that had to deal with the deaths on a daily basis. And one of them came to me yesterday, and the day before, and just said that it was really hard for him to read those names, but that helped him a lot with being able to move forward and move on. And again, I agree with Susan that they've had this PTSD. No, there's no question. Especially my staff that were, well, two groups. I'd say the staff that were here, that were taking care of the residents that were dying in their arms, and the staff that got COVID and were very sick. I didn't get sick. I had COVID and I was fine. So it didn't really affect me, but some of them got so sick that there's a real fear of ever coming back again. And so, yeah, but that's helped a little bit.
That's beautiful. That's a beautiful idea.
Thanks for sharing that, Carolyn. I know we're getting close to time, but I think I've made a note for myself that there might be or there likely would be a benefit for, I think, for us as a community, potentially talking about how we are able to support ourselves, our colleagues and staff through the trauma that you've all and they've all lived through and are currently living through, and what might be ways with both big and small to support, to address things like PTSD and other manifestations of that. So I think that's something that we can bring forward and see what conversations we can hold, and also what resources we might be able to pull forward, because I think it's something that likely a lot of folks would be able to benefit from. The one thing, and I'm going to share my screen very quickly here. I do want to bring it back just to a couple of the things that I know that you've all already mentioned that came up in this presentation. And I actually have heard a number of you talk about this over the last number of weeks. That's one of the reasons I was actually kind of excited about the topic today, because I knew that we had so many leaders and facilities on the line today that have done some of what David was talking about. And looking at how you have and are making yourself visible, how we're finding out what matters to staff, how we're sharing information like you've talked about, how some of those positives are being lifted up and celebrated to highlight what's going well and what we might be able to ensure that we appreciate in one another and also in the resiliency that we have shown. And then making sure that all of our communication is predictable and high value. And those are some ideas that came through in David's presentation. And again, I encourage you to listen to that if you have about 23 minutes, because he does make some really keen observations based on his own experience as an administrator over the last number of months. So one, as I always like to give a leave in action. So here's one suggestion that I have for the coming week. If you have the opportunity or if you can find the opportunity, and this goes for everyone on the phone, not just those who identify as being in a leadership position, but I think also those of you who are here as sort of representatives of your facility leading this work, to sit down with a colleague, a leader, or if you identify as a leader, with someone who you support, and have a conversation around what has been helpful and what has been going well. How are we making sure people are feeling heard and appreciated, and that we need to continue? How do you feel that the information you've received has been? Is there a way that we can improve this? Do you have the information you need? And then what we as colleagues or leaders or staff members might be able to do as part of that COVID-19 response, and what other considerations we might be able to bring forward to those in leadership positions. And I think if we can have that conversation and find ways to connect, and we've had some of these suggestions in other areas of the last number of weeks as well, because we know that in a number of areas, and actually in a number of countries, it's coming out in some of the work that's happening in long-term care in South Africa as well, that it's it's the relational work that's happening that is actually making the biggest difference, I think, for a lot of people, and being able to make sure that we're tapped into how people are feeling and what they need to be able to do this work for the long haul. So that is my piece for this week. And I want to honor and thank all of you for your contributions today, because I think there was a lot of vulnerability and honesty in what you shared, and I really appreciate you bringing into the conversation what you did.
I want to echo Christina, and yes, thank you for being so open and raw, and that was such a powerful session. Thank you. I think that maybe we announced last week, maybe not, but our sessions have been shortened to 1 hour. We are 2 minutes over, forgive us. So for the, out of respect of your time, we're gonna wrap up our session officially. We will be on for another 30 minutes if you'd like to stay on and continue discussion, have questions, anything like that. But before you go, please answer this last poll question. And we thank you for joining us. We look forward to seeing you next week, Wednesday, November the 4th. We'll talk about social isolation during a pandemic and after. And again, if you're interested in presenting a case, please, we'll put it again in the chat. You saw how great the discussion was, great information. All right, many people chose a lot. Wonderful, thank you. Okay, we will end this officially, but we'll still be here if anybody would like to stay on. Thank you all again so much. We'll see you next week.